like to present the Stereotype Threat in Healthcare study by Cleopatra Abdu and Adam Fingerhut. It will be presented by myself, James Hill Jr. I am currently a USC Davis School of Gerontology student. I'm a former Navy sailor, and I plan to use my MA degree to work as a case manager at a VA hospital working with elderly veterans. Stereotype threat is the first of its kind theory being applied in health sciences. It came about with the hypotheses of these two researchers with the thought of if stereotype exists inside of the field of sports and standard academic tests, what may individuals experience in a healthcare setting? And this is a theory. The hypothesis was that stereotype threat, as noted, is a threat of being judged or confirming negative group-based stereotypes experienced in healthcare settings, and is one that's been overlooked, that has serious social barriers implications that can contribute to health disparities among African American women. Because the effects of stereotype threat can have in the healthcare field, many of the participants of the study, African American women, after being exposed to stereotype threat, experienced anxiety after the study once they took the questionnaire. And knowing that anxiety can contribute to real-world consequences in our everyday health, the study can provide an insight to the serious health implications of high blood pressure, stroke, diabetes, and generational future generation health issues that many African Americans and people of color possibly can experience. The study used African American women and Caucasian women because of the thought that would the Caucasian female receive preferential treatment going to see the same doctor, and the study actually used a virtual waiting room for the women to actually be seated. Some of them inside the waiting room actually had negative images of African American women and people, and in some of the waiting rooms there were just basically a normal waiting room without the negative images. And these images can cause us to perceive a group, a culture, a race to be as we've seen based upon a generalization of one individual being applied, and it's actually being applied to a group of people. The healthcare profession, I believe that this study could offer extreme work in which doctors and possibly interns and attendees would be able to use this to become better physicians, in which they, in a sense, would receive a sensitivity training so they can understand that their perceptions and stereotyping can have real-world issues, real-world consequences on the patient of color. The pros of the stereotype threat in healthcare study. As noted, the healthcare-related decisions of African American women can be impacted as far as the utilization of pregnant African American women in their healthcare. Anxiety by African American women, psychological and physiological effects of African American women experienced by exposure to stereotype threat in healthcare. And the cons of stereotype threat in healthcare. It lacked men in this study. And the researchers noted that, in a sense, I guess they didn't want to, muddy the waters with a gender and racial aspect. The study also lacked other minorities. In the future, the researchers stated that Hispanics and Middle Eastern men and women should be included in such a study. Lacked research on community settings, which would be a future endeavor in the healthcare field. Lacked research on the effects of a single provider for the patient. A patient strictly dealing with the one provider they see over a long period of time could make a huge difference in their care. And the real-world applications of the study. This study allows doctors to understand the social barriers in healthcare that might be contributing to and the need for them to address them. It opens the doors of informing public policy in the area of healthcare and disparities that exist. And the study also allows for effective intervention program targeting healthcare professionals to address the disparities that exist in the healthcare profession. In conclusion, I would like to state, stereotype threat in the healthcare profession will only cease when we as a people speak up and challenge its existence in a field that is about helping and not exclusion. Challenge racism every day and everywhere, and it shall end. Thank you.